My name is Laurie Stewart, and I'm here to present my capstone project at the end of this class. In Utah, there's a media campaign called 100 Deadliest Days. This is where on the roads of Utah between Memorial Day and Labor Day, fatalities increased by 35%. And here in 2014, 97 people were killed, which averages out to be one person per day during this campaign. Deaths by motor vehicles, the ones that are killed the most are your children, teenagers, and young adults, or if you look at the ages, it'll be 5 to 34. In 2012, Utah had 2,059 motor vehicle occupants were killed. And during this time, the national average, as you can see by the diagrams, was just a little bit higher than what we had here in Utah. The estimated costs, though, that are not always looked at, for instance, those people that were hospitalized, those people that were treated in an emergency room somewhere, cost our country $226 million. 2.2 million drivers and their passengers were treated in 2012 in an ER for some reason. Utah's crash-related death cost in 2012 was $281 million compared to the United States cost from injuries of $50 billion. That's with a B. But the solution, is there a solution for all these deaths and all this money that is expended? And the most effective way is seatbelts. Everybody wear a seatbelt from the time they get into the car to the time they end, or a vehicle of some sort. The rates of seatbelt use vary among the states. In Utah, it was 82% in 2012, and the national average is 86%. We had the highest is Oregon. Those Oregonians know how to put their seatbelts on, but North Dakotans were only 59%, due mostly to it being a rural area. The least likely people to wear their seatbelts will be teenagers, young adults, men, and adults in rural areas. So here's some death statistics for us. You're most likely to be involved in a motor vehicle accident death in August and less likely in February. Half of all the deaths will occur on a Friday, a Saturday, or a Sunday between the hours of 3 p.m. and 9 p.m. Primary enforcement laws increase seatbelt use, and we know this because a police officer is allowed to stop a driver when they observe them in a vehicle without a seatbelt on. The states here that have primary enforcement seatbelt laws are quite a few. We still have a lot to go, though. We need to be able to get to all 50 states having primary enforcement. And unfortunately, not all of them do. So the strategies to help people increase their seatbelt use, the recommendations come from the National Highway Traffic Safety, CDC, individual states, and the interventions. These are the top 5 interventions: primary enforcement seatbelt laws, improved child safety restraint laws. And when we talk about that of children, we're talking about those that are able to wear the child. They're buckled up in a car seat that's appropriate for their size and their weight, or they are in a booster seat that allows them to still have some kind of restraint before they go into their seatbelts. Media campaigns, just like the 100 Deadliest Days in Utah, many different states have their own media campaigns. Click It, all those that will help prevent some kind, or will bring awareness to the community about wearing seatbelts. Police and sheriff personnel that are present and visible out on the roads helps to help create an increase in seatbelt use also. And lastly, through CDC, they have WISPARS is able to link the medical and crash data to help people or the public understand what are the causes of motor vehicle accidents. In 2013, this was the last year that this data has been published. 14 hasn't caught up yet. 32,179 people died on U.S. roads. I live in central Utah, Sanpete County. We don't even have 32,000 people in our entire county. But each of these people, these 32 plus thousand people, each had a father and a mother, a brother or sister, a husband or wife that is going to be affected by the death of their loved one. And that would have been by a motor vehicle accident. We have to continue to work to help people recognize this is a health issue, that phenomenal amounts of money are being spent on medical costs and on people's lives because they don't take the time to put their seatbelt on each and every time they get into a motor vehicle accident. Thank you, and I appreciate everyone's help throughout this entire course, and many of my fellow students have been with us we've been together a long time, and I appreciate all your help and your assistance throughout this time. Thanks. Bye.